quick tips on what I do at home whenever I have any kind of cough or secretions or anything that I'm trying to get rid of. Disclaimer, this is not medical advice. This is personal advice on how to loosen up phlegm. So let's go ahead and start with steam. So if you can get any kind of big bowl or anything like that with really warm water and you can lean over it with maybe a towel over your head, this is a great place to kind of get you your airway opened up, and you want to loosen up any phlegm or any secretions that are building up there. You want to just inhale that, take good deep breaths as you can. If you cough, spit it out. Anytime you're coughing during that process, spit it out. Now, please consult with your physician if you do have access to something like a nebulizer treatment or anything on that route, because that is also going to loosen up secretions in your lungs and help you expel it. Another really quick tip that I have is something called CPT, and this is where you do chest percussions, because the lining of your lungs is like a really thin drum, and if you shake that up just enough, you can actually shake things off of it and expel it. Whenever you're doing CPT at home, you probably don't have any equipment. We usually have these little cups that we use, but if you don't have that at home, you can actually use your palm. But when you do that, you want to cup your hand, so like in a nice little cup shape, and you're going to go over each lobe. You have 2 lobes on the left side and you have 3 on the right. And your lobes go really high up. So your lung lobes are really big. They come all the way up here and then all the way down here. So it's gonna sound really loud, but it doesn't hurt. You wanna do about a minute on each side over each lobe. Now, if you're quarantined completely alone and you don't have access to somebody else, this is a great way to do this yourself. So you wanna lift up your arm and then you wanna pat over the lobes on the side. And you do this, or at least until you start inducing a cough. So that would be great. And then gravity also works. So gravity can work against you by pulling drainage and fluid and all your secretions down to the lower part of your lobes. Good ways to shift it is by using a ball. You can also do the CPT while being on a ball. You don't have to go all the way forward. It's really just shifting your position and allowing gravity to pull and move those secretions around. We're trying to get them loosened up. We want to get this out of our body. So once you can feel the itch for a cough, cough it up, spit it out. If it were me, I would be doing this every couple of hours. I would also be up and ambulating when I had the energy for it. You don't want to lay in bed all day. You do want your rest and you want plenty of fluids, but ambulating does help move all of this stuff. Get it out of your body. So I hope this helps you guys. If y'all have any questions, y'all can just kind of shoot that below. This is what I do for myself. Like I said before, consult with a physician if you're going to be doing this at home.